Rosacea is a common skin condition that affects the face and most often affects fair-skinned patients, but can affect patients of any racial background. It's chronic and progressive, which means it's long-lasting and will get worse over time unless treated. Some of the most common symptoms of rosacea are persistent background redness, dilated blood vessels, flushing, which is when the face becomes red with a sensation of heat or burning. Some patients even get pimples on the cheeks. Now, rosacea tends to start after the age of 30 and affects women more often than men, but men have more severe symptoms. Well, as I mentioned, rosacea is a chronic and progressive condition, so this means it is very long-lasting and it will get worse over time unless treated. So we try and identify rosacea early when it's in its mildest forms because it's easier to treat and it may have an impact on how far the disease will progress over time. I think it's so important to keep in mind that while rosacea may not have a huge medical impact on patients, it can really affect their sense of self and overall emotional well-being. Onreltea is a topical gel recently approved by Health Canada, the first of its kind, to treat persistent facial redness in patients 18 years of age or older. Onreltea may help patients that have persistent facial redness, background facial redness of the cheeks. When applied to the skin, it will actually constrict the blood vessels so the skin looks less red. When patients apply it, they'll see improvement within typically about 30 minutes, and they'll see the peak effect or the maximum effect by about 3 hours. So this will offer a new option for patients who suffer from persistent facial redness of rosacea. It's important to know that we have no cure for rosacea, and while Onreltea can help control the symptom of background redness, the effects do wear off sometime around 12 hours, and if patients wanted to see the improvement again, they'd need to reapply the treatment. It's also important to emphasize that no treatment is without side effects. In the clinical trials, the most common side effects were a worsening of redness, itching, and burning sensations, which occurred in 1.2 to 3.3% of patients. The side effects were usually mild to moderate. A pea-sized amount of the gel would be applied to each of the following areas: forehead, chin, cheeks, and nose, for a total of 5 pea-sized applications for the whole face. It's important to spread it very evenly, blend towards the edges, and wash your hands thoroughly after application. I'd advise patients with rosacea to work with their dermatologist, first of all, to make sure that the diagnosis is right and that they actually do have rosacea. And second, in addition to medical treatments like we've discussed today, to consider lifestyle measures. So ensure they're avoiding any triggers for their rosacea, practicing fairly strict sun avoidance and protection, avoiding smoking, and also adopting a gentle skincare regimen. This can really help with the signs and symptoms of rosacea. And all of those lifestyle measures paired with medical treatments can really improve symptoms and quality of life for rosacea patients.